Welcome to our Ask the Expert Occupational Therapy Focus on Quality of Life webinar. We are very thankful and excited to have Haley Starter, the occupational therapist at the Hospital for Special Care. Some of you may have seen her at your clinic visits in the Neuromuscular Center, or you may have seen her outpatient or emailed her or talked to her on the phone, but she's worked with a lot of those living with ALS and other neuromuscular disorders. So we are very happy to have her here, and I will pass it over to you, Haley.
All right. Well, thanks for coming. I just have one question on my screen. Like, I can see all of you guys, but do you see yourselves, or can you just see the PowerPoint?
I can see the PowerPoint and everybody. Yeah, I think we're good.
Okay, cool.
Yeah. I see the PowerPoint big and then everyone's little on the sides.
Got it. Okay. All right. Well, I'm Haley. I don't know. I think I know most of you on here. But I just wanted to give a quick little background about myself, because I feel like you can connect with people more when you know about them. So I was born and raised in Connecticut, been here my whole life. Graduated from Sacred Heart University with my kinesiology undergraduate degree, and then I went to Springfield, Massachusetts for my master's in OT. And right when I graduated, I worked in a subacute rehab facility, and then I transitioned to home care. And then thankfully, and I'll never leave, ended up here at the Hospital for Special Care in the height of the pandemic. And I currently work in outpatient rehab and in the neuromuscular clinic. So like Michelle said, you might see me in either one of those places. I'm really passionate about working with this population, but I also treat a lot of other neurological conditions, and I just became certified in stroke rehab a couple months ago. So that's exciting. And then just a little bit about why I became an OT. A lot of people usually are like, oh, well, what made you become an OT instead of a PT? And there's a lot of reasons why, but the main thing is really passionate about helping other people sustain a better quality of life. And I feel like occupational therapy adds a little bit more flexibility with being creative in helping people maintain or at least optimize their quality of life. So that's just a little, I'll save you the long story about why I became an OT, but that's the general part of it. So a lot of times I'll meet people in the clinic and they're like, well, what is occupational therapy? I just saw the PT. Why do I need you? Which doesn't offend me, by the way, because I totally get it. A lot of people don't know what it is. So I wanted to just include what OT is. So we're board certified clinicians who are skilled at supporting the physical, mental, environmental, and social circumstances that might make it difficult for somebody to take part in the things that matter most to them. So in more simple terms, we look at the whole person: mind, body, spirit, physical, mental, social, environmental barriers that may play a role in why somebody's having a difficult time doing something. And then with our training, we can come up with ways to work on the strengths that you have to rehabilitate, or we can help you maintain or plan if there's any difficulties that you have. We have a lot of focus on function. You'll hear me say that a lot, whether you see me on the Zoom or in person. I always like to ask people, well, what is something that's really meaningful to you, and how can we help you get there? I'm just gonna pause because it looks, oh, I was just looking at the chat. Okay, we're good. We have a lot of, so I was saying we have a lot of focus on function. So sometimes people will come in and say, oh, so you're the ones that help us get jobs, right? And we can certainly help assess the abilities that you have and the interests that you have and see what could work, but we don't physically help with getting you placed into a job. And then another misconception is, oh, well, OT is the same as a PT. And if you were working with a really good OT, then you would know that's definitely not the case. Because while some of the things that we do overlap a little bit, We have a distinct role in making sure that there are functional outcomes with certain daily activities. So for instance, if somebody came in and said, you know what, I can't call for help. There's no way I can call for help. Then it's our goal to not necessarily work on strengthening or something like that, but more of a compensatory method of, well, let's figure out a way that you can. Let me just go to the next slide. So there's a lot of things that an occupational therapist will ask you about, and there's a lot of things that we look at. So a few of them are just your everyday living skills. So we call those ADLs, but if you're not familiar with the term, it's just things that you do on a normal basis: bathing, dressing, feeding yourself, grooming yourself, brushing your teeth, managing your clothes, any kind of life necessity type of activities. We also look at medical equipment needs. So are there things that could make you safer in the bathroom, around the house, in your bedroom, common spaces? This is where it gets a little bit of a gray area with PT, because sometimes we'll both be able to recommend, like, hey, try this. But mainly OTs will focus mostly on bathroom, bedroom, living room type of equipment. We also look at your physical function. So I have upper extremity use, so your arm, hand, elbow, forearm, wrist function. I have exercise start, and we'll get back to that a little later. We look at splinting, bracing options, and then just overall like kind of supports for the upper body. And it kind of is interesting when people are like, oh, you're the one that focused, you're the upper and the PTs are the lower. Not necessarily, but I mean, if that helps you remember it, great. If you ever came into clinic and you were worried about something with your hand, you know, I would definitely be a more appropriate person to ask. Conversely, if there was something with your ankle you were questioning, PT would probably be able to give you more answers. But a lot of times we like to collaborate together. So don't ever feel that just because it's one thing doesn't mean that you can't ask around to get other opinions. That's my little tangent. We also look at mobility, so your balance. If there's anything with your functional mobility, like walking, getting around, getting from one place to another, or one seat to another, and just overall positioning. My newest favorite thing that I didn't know even existed in the world of OT until I came to the hospital for special care is assistive technology. So we can figure out ways to have people be successful with using the computer, phones for either fun or leisure purposes, work-related purposes. Again, not that we're getting you a job, but we can help work on the skills to potentially maintain a position if you're in one. And we can do these through a whole slew of things, whether it's with your voice, hands-free. So we'll get into that a little bit later, but I'm starting to really like that part of the field that we cover. Not that this necessarily relates to ALS in particular, but OTs are skilled at looking at vision. So a lot of our neuro patients who might have neglect, double vision, peripheral issues, I just thought that that was kind of interesting to know. And driving. So in the state of Connecticut, there are a few occupational therapists that are certified to assess somebody's ability to physically drive. But most OTs can work on just the general skills like multitasking, processing, coordination, reaction time. And we can see if that's, you know, something that's of concern or something that you're okay with. And we can always make recommendations or modifications from there. So that's that. So I have, I kind of just went through a lot. I tried to base this presentation on questions that I get asked a lot in like team visits. Because a lot of times people are like, well, what's covered under my insurance? Like, you're recommending this toilet seat. Well, how can I get that, for instance? So I just defined like what durable medical equipment is in case you ever hear any of us say that. Sometimes people don't know what that is. But basically, it's just equipment that's considered medically necessary as prescribed by your physician for use in a patient's home. Medicare considers durable medical equipment as any equipment that can withstand repeated use when used for a medical reason throughout the lifetime of a person. It must be at least 3 years, and it must not be considered useful to somebody who is not sick or injured, meaning that if you have difficulties, they expect that this would be something that's used for a long period of time, forever. So OTs can help determine safe, necessary equipment for like toilets, showers. We also kind of tie in with PT a little bit and can make recommendations for mobility aids such as walkers, mechanical lifts. We can help you get hospital beds and determine if you're a candidate to try to get one covered by insurance, or if you even need one. I did want to talk a little bit about insurance coverage, because I would say that's one of the biggest questions. So there's certain insurances that don't cover toilet, bathroom type of equipment, and there's certain ones that do. So I would always, certainly you can ask your OT, whether it's me or somebody else in the clinic or in your community. But the thing I like to tell people is if your insurance does not cover what we're recommending, there are other options such as the ALS loan closet. There's also community loan closets where people have donated equipment to in hopes that it gets used by somebody who needs it, typically for free. I have a whole list of those places in the state of Connecticut. I'm not sure if it's ever been shared with you, but if you are interested in it, I can certainly attach it to this presentation. And then there's also local senior centers. Some people prefer to just purchase things on their own, and that's okay too, but I would always ask your OT if this is something that they can help you look into, because I don't like people to feel burdened financially. If there's all these things that are getting recommended, don't feel like you have to just buy everything. And I like to think of it too as I don't like to recommend something that I know somebody's only going to need for a month. Typically, we like to look at the whole picture, future planning, like what does make the most sense for the home setup, the person, and how long they might need it for, to hopefully be a little bit smarter about it. But all in all, any type of durable medical equipment can improve your overall quality of life, increasing your independence with mobility, your safety, preventing falls, making things feel less taxing. So I know the feedback that I've gotten from people in the past is it's very difficult to accept getting something because some people think that they're handicapped. But really, I like to try to spin it in a positive way that, well, this could really make a difference in your caregiver or your own quality of life. So that's my little tidbit. So just I'm sure you guys all know about these, but I just wanted to include them anyway. These are just a few. It's not everything because I would have like 20 slides probably. But some of the more common ones that we tend to recommend, the standard commode, really nice to have it. It's versatile. You can put it in your bedroom if you need to get to it right away, or you can take the bucket out and put it over a toilet. It's nice because you can adjust the height to accommodate whatever needs you have. There's a Versa frame, which is just the arm supports that goes down to the floor. I like this one in particular because it's a little bit more secure. You'll see other ones online that are just like bars with one little rail here, and they're a little bit more rickety. Raised toilet seat. This is a common one that people will bring if they're visiting friends often. And you're going to some place that might have like a lower toilet and you need the seat a little higher to stand up from it easier. Grab bars are always a good thing. There's also handicap rails. These are toilet rails. So these are just arm rests that don't go all the way down to the floor. It depends on like the sturdiness of your toilet and what your what your needs are. This one's really cool. I did not know about this until a couple years ago. But But a lot of times people will say like, all right, I've got a low toilet. I don't really have enough space for equipment. All I really need is for the toilet to be higher, but for me to go out and buy a comfort height toilet in a Lowe's is so expensive. So there's this thing called a toilevator. No, I did not make that name up. But it's really cool. It does require some assistance from a professional to physically remove the toilet from the floor. And it adds about 3 to 4 inches under the toilet to raise it higher. So it almost kind of simulates a comfort height toilet for a little bit less of a cost. So I have recommended, there are some people who have pursued it and they've said that it's been great. So again, all just depends on the needs of the person and what makes sense to you. Some of you, this might not apply at all. Some you might have never heard of any of these things. So my goal is just that you're aware. And I think a lot of this too is especially because all of you guys are probably in a support group. If you're talking to somebody and they seem like they're struggling or they're not sure, you could be a resource after this presentation by saying, hey, I heard about something called a toilevator. Have you thought about that? So even if this doesn't apply to you, it's just kind of good to know for helping others. And then there's also this floor to ceiling grab bar. A lot of times people will use this to either help like pull them up from a toilet or get in and out of a shower. It does require you to have a certain height, ceiling height. And I would say this, I usually get asked, how much does this cost? It's usually a couple $100s. And again, I would only recommend it if it really like made sense for the person. I guess I put it on twice. So we don't have to go over that one. For the shower specifically, there's just basic shower chairs with a backrest and armrest. I like to recommend this over a stool for somebody who's starting to potentially think about wanting equipment, especially if it helps them reduce their risk of falls. A lot of times people will tell me, well, I feel like I've got to hold on to the shower walls, or, aside from that, I feel like I get tired in the shower. Well, having a chair on standby is usually something that is recommended, because you don't ever want to be put into a situation where you wish you had something and it's not there. They also make these tub grab bars, which are really nice. They kind of clamp on to the edge of the tub here, and it allows you to put some upper body support to help lift your legs in and out. This one's really good for people who might live in a condo or an apartment or somewhere where they really can't do any kind of like drilling or reconstruction. So I have recommended this one. This is a tub transfer bench. These two, this one doesn't have a sliding seat. This one does. There's pros and cons to both. And it usually is really helpful for people who might have a tub, but they really can't step in and out. It's very exhausting, or their balance isn't right. So you can talk to your OT about if one of these would be appropriate. One of my other favorite ones that I'm so thankful is out in the market are these shower chair commodes. So really nice. Some of them, this specific picture, it does not tilt, but there's other ones that will have a tilt to them. It's really nice for people who do have access to a bathroom, especially on the first floor, because you can, be hoyered or transferred into this. It can roll over the toilet, so you could use a toilet, and it can roll into a barrier-free shower. So the person still has the ability to use the bathroom upright and also take a shower if they need to. And one of the other things that I forgot to mention that OTs have a lot of knowledge in is kind of preparation. I know some of you might be past this, but again, just as a reference or a resource, it's kind of good to educate people if they are looking into doing bathroom remodels. Long term, what are some of the things that are really going to make quality of life better if the person is able to do it? I've had a lot of people that have come in and said, oh, we're gonna do a handicap tub, and when they do the cost comparison between that and just a barrier-free shower, it really does make a difference. So these are really nice is my main point to that. Sometimes I ramble. Okay, so adaptive equipment. I mentioned in my previous slides that OTs are really creative at helping you figure out how to do something, maybe not the same way you used to do it, but is there a way that we can just maintain your level of independence and confidence as long as we possibly can with whatever function you have? So I kind of just went through each little activity of daily living for any of you that remember that term. So for instance, self-feeding. So there's all different kinds of utensils, cutting boards, choppers, grippers. This one here is a one-handed knife. So if you have an extremity that's a little bit stronger than the other, this one's really helpful. I'm sure you guys have all probably seen these built-up utensils. There's ones that have little cuffs to them. And there's ones that are just wider in case like holding things finely are difficult. This one's really cool. Did not know this existed. And honestly, you guys could probably share at the end of this if there's anything that I didn't present on here that you found to be helpful, because there are so many things out there. And there's new things coming every day, but this is a one-handed cutting board. So this knife is on a pivot. So you one-handed, you can take the knife and chop. Again, this would be for somebody who has a little bit stronger function in one side versus the other. It has little suction cups on the bottom. This one's cool for individuals that might have like decreased hand strength, but still have the ability to get a drink to their mouth. You can slip your hand through it, and it's kind of like I shouldn't say hands-free, but you can stabilize it in your hand and bring it to your mouth. One thing I didn't mention in here or put a picture on is like an elongated straw. So if you don't have ability to use your arms at all, but you still want to be able to get liquid into your mouth, there's so many other options out there, but one of them are straws, whether it's coming from your wheelchair or it's coming from a cup on a table, and you can kind of bend forward and sip through it. So that's another little tidbit. This is a jar opener. There's an electric one and a regular one that's on the you could put under a cabinet or somewhere in the kitchen. Pliers, probably one of the most versatile things that you can use aside from what you think you can use them for. For those of you that might know people who are in the beginning stages of ALS and they're complaining, maybe they have complaints about, picking things up is hard, turning things, getting credit cards out of gas station type of gas station things. I don't know what you call them. But pliers are really good because it gives you a little bit better torque. You don't have to hold things on so finely. I actually had a woman who had a grandfather clock, and the only thing she wanted to be able to do was to just make sure she could turn the key. So I worked with her in the home. I had her take a pair of pliers. She had enough strength to do this. And with the pliers, she was able to turn the grandfather clock for a couple extra months, which really means a lot to people. This is a one-handed chopper. So again, if you have the ability, if one side is stronger than the other and you want to be doing some chopping, dicing, this is just another little jar opener gripper. For grooming, I try to include things that maybe aren't so obvious. So this is like an adaptive nail clipper. I find that a lot of the nail clippers are like super thin. So there's been times where people have a little bit more gross grasp than they do fine motor. So something like that's helpful. I don't know if any of you have pets, but I have, and it depends on the person, but I have recommended like an electric nail trimmer for people. If they have enough ability to hold and safely kind of like groom the nails this way. I think they do make them for humans as well. And I think that's what this is, but I can't say that I have never recommended the Dremel pet groomer for people, because I totally have. And again, as long as you're safe, but it's just like a little vibration. This one is really cool. I've had 2 people that have used it and they've both said that it's better than the alternative of not brushing their teeth. Sometimes people are really sensitive if caregivers have to brush their teeth, you know, because it's hard for them to know, are they getting in enough, or is the person just sensitive with their gag reflex? So this is a hands-free, so you don't have to have any function. The only thing you have to have is somebody to help set it up in your mouth, and press the button, and it has bristles in it, and it vibrates and it cleans your teeth for you. I believe it's up to 60 seconds. But there have been some people who have had some sensitivities to caregivers brushing, and they've just not done it. But oral hygiene is probably one of the most important things for anybody, regardless of what they have, because if you get an infection or bacteria in the mouth, it could spread to anywhere in the body. So oral hygiene is an absolute must. So if you know of anybody or yourself who's sensitive to it, something like this could be helpful. All of these things you can find on Amazon. And again, this is called a hands-free toothbrush. If you type that in Google, it'll come up. This is a universal cuff. So I don't know if some of you may have heard of it, but basically it looks like a hairband, but a little bit wider. You can slip it on to your wrist. If you still have the ability to do this, you know, you can stick something like a toothbrush. I have a patient that puts on mascara with a universal cuff. You can do writing instruments, utensils, and it just is another like hands-free option for performing some grooming things. Built up handles on the toothbrush, and then this is a toenail clipper. I can't say that I've ever tried it with anybody, but I found it and I was like, huh, that's kind of interesting. Again, this would be for somebody who's maybe starting out with ALS and is having a little bit of difficulty lifting their leg or bending down, and they don't have support to help them. So I just thought that was interesting. So one of the other areas that OTs work in is helping people in the bathroom. And I know this is, sometimes it's a little bit of a personal subject, but don't ever feel afraid to talk about any bathroom needs with an OT, because we're here to help, and we just want to make everything as easy and safe and convenient for you as possible. So I will ask questions in clinic if it's appropriate for the person. You know, can you perform hygiene? Are you able to wipe yourself? Do you need assistance? Is it something that I feel that you have enough abilities to try to figure out how to do it on your own with some adaptive devices? So one of them is a bidet. You have to have a little bit of ability to twist a dial. They also make bidets that are like remote control, and maybe for somebody who doesn't have hand function but has like ability to wiggle their toes or bring their foot up and down, you could always tape the remote on the bathroom floor and use it with your feet. This is kind of where that like gray area of PT comes in. But it's a way for you to perform some hygiene with a little bit more ease. There's also this toilet wand. I've heard mixed reviews about it. I have some patients that love it, some that are like, it doesn't work. But essentially you take toilet paper and you stuff it through here, and it just allows you to kind of move your arm. You don't have to internally rotate your arm as much to get back there. There's also some people where these female urinals are applicable. I'm thinking of a woman right now who I saw in clinic who has ALS. She has a really hard time sitting up, and she goes out to restaurants a lot. And unfortunately, handicap bathrooms aren't always totally accessible with the low toilets. So we ended up finding this female urinal, and all she has to do was take it out and pee into it, and then the stream flows into the toilet, so she can still use a public restroom without having to be burdened or worried about how she was going to get up. So that's the toilet. For bathing, there's different sponges, long-handled sponge or just bath mitts. I actually just worked with a woman who has a really hard time squeezing bottles. She was newly diagnosed, and I had recommended like pump style bottles where she can kind of push more from her bicep and her forearm versus her hand where she's feeling a little weaker. So just because I'm not like showing things doesn't mean they don't exist out there. And like I've been saying, a lot of times it just is dependent on the person expressing what do they need to be able to do? What are they having a hard time with? And can myself or any other OT help them figure out a way to do it? For dressing, there's these are the universal cuffs I was kind of talking to you about. So you can attach those to pretty much anything. There's a sock aid, reacher, shoehorn, the grabber, and then I included these. A lot of times, especially when somebody is a newly diagnosed patient, they'll say things like zippering are hard, or like zippering, unzippering jackets. So pulling up pants is another one. So if they're pants that have loops, I have had people add these little rings to the side, or a little bit bigger, like these carabiner clips, so that they can loop their thumbs under to pull up and use more of their biceps if their fingers or hands are feeling weak. Also, just a side note, really good for kids that are struggling to figure it out. If any of you have grandchildren. And then I just included some other general adaptive equipment things that you wouldn't think are out there, but are. There's key turners here. This is like a wider key turner for somebody that might need a little bit bigger grasp. There's these doorknob handle turners. It basically helps you with your traction, your grip, and you can get a little bit more of like a forceful turn. These are one-handed scissors for cutting, in case you're interested in doing crafts, or even like cutting meats and stuff like that. And then this was interesting. This was just like a universal water, soda, soup type of bottle opener, can opener. That was an Amazon special. All right. So occupational therapy and ALS, what does an assessment look like? You probably have somewhat of an idea, hopefully by now, of what OTs do and the things that we look at. But I'll just reiterate the role of OT with any diagnosis, ALS, stroke, orthopedic injury, is how can we help maintain or enhance a meaningful quality of life for you? With ALS in particular, our primary focus is on maintaining function and preventing decline for as long as possible. We can't physically prevent muscle and nerve involvement, but we can help prevent the functional ability of the person. We assess hand function, all activities of daily living, any bracing needs, equipment, work, or things that you like to do for fun, exercise programs and considerations, and we can provide patient family education and support. I'm kind of repeating myself here, but we help determine the need for adaptive equipment and helping you figure out different ways to complete things. And also assessment of pre-driving skills, and or if there's any sort of formal testing or assessments that may be recommended if you're somebody that's like, I'm not sure if I should be driving anymore. We could refer you out to a couple programs that I know of in the state of Connecticut that could help with that. Okay, so some considerations with ALS in particular. What type of setup does the person have at home? And this would help determine what type of equipment do you need. So for instance, I got a narrow door frame. I have a bathroom on the first floor, but my wheelchair doesn't fit through it. Well, can we figure out, does potentially one of those rolling shower chairs make sense that are a little bit more narrow that you could get hoyered into that could fit through the bathroom? So at least you could go to the bathroom in an upright position versus having to use a bedpan. Again, it's not this easy for every single person, but I'm just using it as an example. Is there a way that, okay, well, you know what, I have a bathroom upstairs and I cannot get to it. Well, could we try one of those commodes, or could we get you a shower chair with a commode chair with a bucket? that you could have at least downstairs if you were looking to go in an upright position versus having to lay down. Another consideration is, how does their morning or nighttime routine look? How do they occupy their time? Are there ways that we can make things easier through accommodation, adaptations, or compensatory strategies? So this reminds me of a woman I saw recently who is still fairly independent, but she's just very tired. And I was talking to her, and we found that she was doing like housekeeping, laundry, meal prepping, like all in the same morning routine, and it was exhausting her for the nighttime. So I helped her figure out ways, and you'd think it's silly, but it really does make a difference of how she could plan and prioritize activities and save energy. You'll hear that a lot, energy conservation. You know, how can we maximize your ability throughout the day for as long as you can, while still doing the things that you need to be able to do if it's appropriate. Another thing, how do their upper extremities present? Do they need bracing, stretching, exercise programs? I won't mention a name, but one of you on here, I just recently had a conversation about this with, is I wish, or I try my best to educate patients on, you know, if their fingers are starting to curl or cramp, or their shoulders are starting to get tight, the importance of pursuing bracing and consistent stretching, because over time it might pose as a barrier. You might have pain. Caregivers might have a hard time getting clothing on you. So it's really important to ask questions and stay consistent with the recommendations that are made, because the patients who have beautiful hands, no pain, very well groomed, life is good in terms of positioning for that. So same thing with shoulders. It's really easier for them to get shirts and jackets and things like that on. So really, really important to stress the need for bracing, stretching if it's appropriate to you. And then, is there any meaningful occupation or activity that the patient wants to be able to do that is realistic? So whether you were just recently diagnosed or you've had ALS for a little while, I have another individual on here who I worked closely with to help them use a computer totally hands-free with the help of their grandson. So this doesn't just relate to people who are newly diagnosed. It can be throughout your time. It just depends on, you know, what it is that you're looking to do. And then one of my most important ones is, does this person have a way to call for help? You might be somebody who has loss of speech, hand function, leg function, but that doesn't mean that you're not a candidate for figuring out a way to call for help, because communication is super important, and so is emergency preparedness, because you might be with a caregiver 24/7, but what if something happened to that person? You always want to make sure that there is some sort of system set up, and usually your speech therapist and OT can work together, whether it's eye gaze, or do you have another body part that moves that you could hit a button for, or is there another system that we can put in place right away? And this might change as the disease changes, and your physical presentation changes, but this is always something that you want to have in mind, or you want to at least spread the awareness for others to keep in mind, because it's important. All right, misconceptions with ALS. If I can no longer do something the way I used to, I'll never be able to do it again. So for example, using a computer or phone. I had a patient who has very limited use of his arms and legs. But that doesn't mean that he is now cut off from ever communicating or doing leisurely type things on computers and technology. So there's several types of assistive technology equipment and hands-free options to continue doing those things. Again, every situation is going to vary based on the person and how they present. But it kind of breaks my heart when people think like, oh, well, no, I can't do it. And my goal for people is, if there is a realistic way that you can do it, how can I help you do it? And then another example is difficulty with buttoning. Therefore, I just can't wear a dress shirt and I've got to go to my granddaughter's wedding in a jacket, you know, something else. So there's different types of adaptive equipment. You can alter clothing, such as, you know, with Velcro, loops, magnets, and there's other ways of performing these, this dressing example that might make a person feel more confident and able-bodied, even if it's just for one event or one short-term period. So the moral of that is, like I said, don't ever be afraid to talk openly with your OT if there is something realistic that you wanted to be able to do and you just need some guidance, or you have a friend that might need some help. I'm always willing to try to problem solve. Another misconception is I should exercise rigorously to prevent myself from losing strength. So for example, lifting a 10-pound weight many times a day. From the view of an OT, we might rather encourage people to rely on their daily functional abilities to help maintain their physical presentation versus overly taxing your body by doing 10-pound weighted bicep curls. And this isn't to say that you should never exercise, but everything in moderation and the type of exercise that you do is crucial. I've already kind of mentioned this, but I'm more of a fan of let's just have you maintain your endurance and your functional abilities throughout the day. And let's focus more, regardless of who it is, on stretching, posture, positioning to prevent pain, muscle stiffness, joint tightness, that type of stuff. And I put this in bold because I hope if it just resonates with one of you, that functional participation in meaningful activities is much better than going to a gym or doing exercises that are completely exhausting you to now where you have to rely on somebody to help you do something that you otherwise could have done just by doing a little bit different type of exercise. So some takeaways. OT can play a crucial part in helping you maintain your overall quality of life through the use of education regarding adaptive equipment, durable medical equipment, problem solving through creative alternative ideas on how to do things is what we strive to do for all of our patients. We want you to do what makes you feel good. If you wake up one day and feel like you've overdone it, then maybe take a step back, modify routines. This also goes for caregivers as well. It's not just the patients, but it's anybody. Conserving energy, simplifying routines, and thinking ahead is critical to maintain safety and good quality of life. OTs, again, have a huge focus on quality of life and function versus rigorous, strenuous exercise. If exercising is meaningful to you, let's talk about a way that we can make sure function and what you're looking for all stay in the same sort of same area. And then also always reach out to your local OT if you have any questions or concerns. And that's it.
Thank you so much, Haley.
Yep.
I appreciate it. So feel free to, you guys can write questions into the chat. You can just